Hey guys, what's up? It's Noelle. Welcome back to my channel. So I'm back with another sit down video about nursing. This video, by the title, you can probably tell, is about everything you can do with a nursing degree. When I say nursing degree, I mean a BSN, Bachelor of Science in Nursing. Yes, there's the whole associate's degree thing, but I'm just talking kind of like traditional, once you are a registered nurse, what you can do with that degree, what units you can work on, other degrees you can get after your nursing degree. So we're gonna get into all of that right now because I hate long intros. So let's just get started. So I have a list here. I did some research. I Googled multiple different hospitals, kind of what units they had, and also from my experience, from friends that I've had, like what they've gone into if they're not doing bedside nursing. So I kind of just pooled a lot of information to kind of give you guys a list, and I'll honestly just copy and paste this and post it in the description below so that you guys can just see a full list of all the units and things you can do. I'm more of like a visual person anyway, so that would help me. So to start off, I do want to say that not every hospital has every unit that I'm going to mention. There are bigger hospitals, there are smaller hospitals, there are children's hospitals, which are only for children, and then there are hospitals that have both children and adult units in them as well. So just to clarify, if you are researching your local hospital, they may not have all of these units. I'm gonna start off with what you guys probably assume when you think about nursing. So like hospital inpatient units. To start off with the inpatient units, you have intensive care units and non-intensive care units. So intensive care, meaning ICUs, you've probably heard that term a lot. That's what it stands for. And then you have non-intensive, so not as sick as the patients in the ICU. So I split it into two categories. So we'll start with intensive care units. Obviously at the top, neonatal ICU. So that's the unit that I work in. That's all the premature, sick babies, anything out of the ordinary will go to the NICU. And then we have the pediatric ICU. So that's just pediatric. So usually 2 and above. Sometimes it will be under 2, but that is if like the baby goes home, maybe 3 months in, they get sick, they get RSV, maybe they'll go to the ICU, maybe they'll just go to general peds. Cardiac ICU, so your heart, anything that has to do with the heart. And I will mention that in children's hospitals, there are all these units specifically for children. So there's like a pediatric CICU, which is cardiac ICU. And then there's a pediatric surgical, medical, so I just want to clarify that. But I'm just talking about kind of like a general hospital. These are the units that they would have in them. So cardiac ICU, there's a surgical ICU and a medical ICU. So those are kind of just how they sound. Surgical meaning if you had surgery, medical meaning anything that's not related to surgery. And you need extensive care. And then there's a long-term ICU, meaning that if a patient has, is there for months on months and they're attached to the ventilator, they would probably be in that unit. And then we'll go to non-intensive. So there's labor and delivery. That's where moms go to deliver babies. Then there's antepartum, which is mothers who are pregnant, who just maybe are on bed rest and need to just be in the hospital a couple months before they deliver. If they're super high risk, maybe they'll be there for a little bit before they go into labor and delivery and are ready to deliver their baby. Then there's mother baby, which is postpartum. So after they've had their baby, they'll stay in labor delivery for a couple hours and then they'll move to mother baby once, they're less of a risk. And then that's where they can have the baby rooming in with them. That's where they learn all their discharge teaching and all of that stuff. Then there's general peds. So I mentioned earlier the pediatric ICU, which is like super sick kids. General peds, usually if you have a common cold and you need to be in the hospital, get some medication, you'll be in that unit. And to remind you guys, pediatrics is up until the age of 18. So you have, like I mentioned before, you could have 3-month-old or you could have an 18-year-old. Another non-intensive unit is a step-down unit. So that's post-ICU care. It's kind of a transitional phase. They're not maybe ready for just like the plain medical unit. So it's kind of step down. So I would say it's more like in-between care. It's not like they're super sick, but they're also not just there for like something routine. Then there's an oncology floor, which includes cancer, because that's what oncology is. But then it also includes immune system disorders. There are surgical units, so if you go in for a routine hip surgery, a knee surgery, after your surgery, you'll go to that unit to recover. You'll get rehab, physical therapy, all of that stuff. There's a PACU, which is post-anesthesia. So right when you come out of surgery, that's the unit you would go to. Those nurses would make sure that you don't have any side effects coming off the anesthesia. They would make sure that you actually wake up and, you know, become alert again. You're okay to walk around, and like you've gone to the bathroom, and they just make sure everything is how it should be after surgery. And then you have medical units. So this is maybe like if you had a stroke, you would go here, or if you had a mild heart attack, and you just needed a little more, you needed to be watched in the hospital, but it's not like you're on a ventilator or like you're super sick, you're on all these drips and like high-level medications. Then you have rehab and long-term care wards. So this is, again, if you're in the hospital for months and you need more like developmental care, these units look at more long-term stuff. Okay, how would we transition into the home? They can follow up on certain things a little better than just like the inpatient units that are focused, okay, like let's get this person healthy, let's get this person home. Longer term, think about more of like maybe home health, integrating that and things like that. So other units that are still in the hospital that I didn't really think fit into intensive care unit or non-intensive, there's the ER, emergency room. You guys are probably familiar with that. That's where you go to get checked in after hours, if you have an emergency. There's a trauma ward, which is usually within the emergency room. Some hospitals have trauma units, some don't. There are different levels to it. I don't know all of them, but I think it goes up to 3. The higher the number, the more trauma, like, and when we say trauma, it's like gunshot wounds, like stabbings, or like burns even, maybe like right when they come into the emergency, things like that. And then you have your psych ward, which psych patients, so that's a lot of mental health. It's a little bit different. It's usually a locked unit. It runs differently from other units in the hospital. Those patients usually have to stay for a set period of time. The nursing is a little bit different. I only know from my clinical, but they're designed more, not as much like a hospital, and you know, they have all the safety precautions as well. And then there's an operating room nurse, which is very different from the rest of nursing. You actually in that job have more of like a 9 to 5, 8 to 3 schedule. So in that role, you're basically the right-hand man to the surgeon. You're counting all of the equipment, supplies, what are those called? Utensils, whatever they're called, making sure, you know, they're all there, counting that, setting that up, helping keep everything sterile, and just assisting in any surgery. And then the last kind of non-categorical unit is the Cath Lab, and those nurses just help with recovery post-cath. So catheter for like heart, looking at your heart functions, looking at the pressures and arteries for stents and things like that, surgeries, or in infants like PDA coils. So those are kind of the majority of, in a hospital, your standard hospital, not specifically children's hospital. Those are the units that you would see and units that you could work in. And then some other things, like I mentioned before, there are children's hospitals specifically for children. They have all the ICUs, emergency room just for children. If you live in a big city, you probably have a big children's hospital that you are aware of. And then other things you can do as a nurse is a flight or transport nurse. Some hospitals have specific teams and that's all they do. And then some units, like my old NICU, you could do that as a NICU nurse in the unit. You could work bedside and do the flight transport as well. So flight and transport nurse just means that you go pick up via helicopter or ambulance, sometimes even plane if you are in like a huge hospital and they go overseas or whatever. But you just pick up patients from other hospitals that can't do a specific surgery or don't have the level of care that that patient needs, and you'll bring them to the other hospital. You can also be a home nurse or home care. That is basically going into the home of the patient. So maybe they just need weekly checkups for a wound, or like they need weekly checkups for diabetes and like the management of that. There are other programs like WIC, I think, that have nurses go and check up on mothers and babies and children. But home care, meaning you are going to their home, you drive in your car, you have all your supplies in the back or the trunk, you have an agency that you work through and that gives you patients to go to. That again is more of a 9-to-5 type of job, because I mean, people aren't going to want you to come in the middle of the night to wake them up and check on all that stuff. There are also home nurses who help with long-term care. I know in the NICU especially, like if a baby goes home on a vent or on oxygen, they're entitled, depending on their insurance, they get a nurse to come overnight and help them with the cares and all the machines. And then also you can be a school nurse. To be a school nurse, I'm pretty sure you don't have to be a registered nurse. I'm not 100% positive, but I know a lot of nurses become a school nurse just because that works with their child's schedule. The hours are better, and like I said, you have off during the summer when your kid has off, and it kind of lines up like that. And then you can be a public health nurse. So that can mean a whole spew of things. That could mean like studying research in rural areas and figuring out, you know, what they need. Even like with all these COVID cases, like you could be studying why maybe certain areas, or how to prevent the spread of COVID amongst schools, stuff like that. So that is also an option. And then other things are outpatient. So I mentioned all the inpatient units. Outpatient units usually are units, you know, you just go in for an appointment or a simple surgery. You're there for a couple hours and then you go home. So there's the same day surgery, like I said, maybe like cataract surgery, or I don't know. That's the only one that comes to mind. But easy surgeries that you don't need a long recovery in the hospital being monitored for. You know, you have your like friend drop you off, you get your surgery done, and you have your friend pick you up, take you home, and you just rest for the rest of the day. Surgeries like that. And then you have outpatient clinics, and then you have family practices, like probably, unless you go to a hospital to do your yearly checkups at the doctor, those smaller offices, you can be a nurse there. You mainly just do vital signs, give people their shots, make sure they're up to date on that stuff. So those are also other options. And then outpatient clinics could also include, like, I know one of our nurses at my hospital now, she left to go do like plastic surgery, be a nurse at a plastic surgery practice. So that is also another option. So that kind of wraps up all the things that I could think of that you could do with a nursing degree. If you guys are from any of the units that I mentioned and have a better kind of day-to-day of what you do, please comment down below. Don't come at me if I explained your unit wrong. Like I said, I am a NICU nurse. I work in the neonatal ICU. I've got all this information from the internet, but also from my experiences and friends that I have who have branched out to do other things. So I'm no expert in all the units and all the things nursing, but I just wanted to get this video out for you guys because I think it was a great idea for my subscriber. And then also just like, I don't know, I feel like you don't know about all the things you can do as a nurse. There's so much you can do. That's why it is such a good degree, because you have a lot of job security. One, because there's a nursing shortage and nurses are always needed, but like you'll never not have a job if you become a nurse. So that is one really, really positive thing about this degree. So I hope if you're in nursing school, this gives you hope. If you're not in the right unit, there are so many units that you can choose from. So don't be afraid to kind of just like jump out of your comfort zone, try a new unit out. Maybe you'll end up loving it. I don't know, but those are kind of the main units, the main things that you can do as a nurse. But before I end this video, I want to talk about really quickly higher education and grad school, things that you can do beyond nursing. So if you keep up with my videos, you guys know that I'm in grad school for healthcare informatics. That is kind of a newer field, getting introduced into the healthcare sector. But it's basically the bridge between healthcare and IT. I find it very interesting. A lot of people, when I mention it to them, are like, aren't you bored? Isn't that very boring? But some of the things that I'm learning is about like how robots and technology advancements are affecting the healthcare industry, how social media is playing a role in healthcare, and how, you know, you see a lot of doctors and medical people advertising their clinics on TikTok and Instagram and all the reels and all of that stuff. And then also just like telehealth with COVID, that's been a big thing. So those are some of the things that I'm learning. Those are some of the things that are covered in healthcare informatics. A super popular second degree for nurses is becoming a nurse practitioner. Nurse practitioners are kind of more like doctors, but not totally a doctor. You can start giving orders and prescribing medications. A nurse cannot do either of those things. So you have a little more power, I would say. Obviously, you go to more schooling, and you could start your own practice if you want. There's many types of nurse practitioners. So if that interests you, definitely, you know, do your research. You could become a midwife, which is someone who delivers babies. Other degrees, you could become a nurse educator. So that's someone, especially, you know, with newer nurses, usually a hospital will have an education program for the specific unit, just learning, you know, the basics of maybe some disease processes that would happen or that you would see on your unit. They also help keep track of continuing education, because that's a big thing with nursing. You have to keep up with your education, make sure you're up to date with all the new medical stuff, the evidence-based practices that are coming out. You could go into management and business administration or hospital administration. Again, those are just the things that come to mind, the things that I know of. But again, if you have more experience with something else that you've transitioned from nursing into whatever you are now, please comment down below. I'm sure that'd be super helpful. And then also, just if you hate nursing altogether, just go back to school and get a total different degree, business, whatever it is. But like I said, nursing, I think, is a great degree to have. If you start off in a unit and you hate it, don't be afraid to branch out. Go to another unit, go to a different hospital. Different hospitals, like I said, run differently, have different units. Maybe the culture is a little bit different. There are magnet hospitals which have to apply and meet certain criteria. There's teaching hospitals, non-teaching hospitals. There's just so much out there. So if you're unhappy in a certain spot, don't be afraid to change. And also, I hope this helped. Like I said, I'm not an expert, so don't come at me if I got some information wrong, but I just wanted to kind of start the conversation for you, or start the wheels turning in your brain of like, oh wow, there's actually more than just a pediatric floor, an adult floor, and a baby unit. There's so much more out there, okay? So that's kind of just what I wanted to get across with this video. I hope this helped. If it did, give it a big thumbs up. Also, leave your comments below if you have any more questions or want me to elaborate on anything else. And yeah, I hope you guys enjoyed. Don't forget to subscribe, and I'll see you guys in the next one. Bye.